Genetic counseling introduction. The term genetics was introduced by Bateson in 1906. It has been derived from Greek word which means to become or to grow into. Providing information regarding health and support by the specialist doctor, a geneticist, to a client, the person who performed genetic test. A person giving genetic advice is called counselor. A person seeking genetic advice is called consultant. Genetic counseling is a service that provide information and advice about genetic condition. These are condition caused by changes known as mutation in certain genes and are usually passed down through a family. Definition. Genetic counseling is a process by which patients or relatives, at risk of an inherited disorder, are advised of the consequences and nature of the disorder, the probability of developing or transmitting it, and the options open to them in management and family planning in order to prevent or avoid. Genetic counseling is the process of helping people understand and adapt to the medical, psychological and familial implications of genetic contributions to disease. This process integrates the interpretation of family and medical histories to assess the chance of disease occurrence or reoccurrence, education about inheritance, testing, management, prevention, resources and research, and counseling to promote informed choices and adaptation to the risk or condition by National Society of Genetic Counselors. Genetic counseling is the communication of information and advice about inherited conditions. Genetic counseling is a communication process which deals with the human problems associated with the occurrence or the risk of occurrence of the genetic disorders in a family. Genetics is defined as a branch of medical science which concerned with the transmission of characteristics from parents to offspring. Genetic counseling is a process by which parents or relatives at the risk of an inherited disorder are advised of the consequences and nature of the disorder, the probability of developing or transmitting it, and the options open to them in management and family planning in order to prevent or avoid it. Types of genetic counseling. There are two types of genetic counseling. 1. Prospective genetic counseling. This allows for the prevention of disease. It identifies the individuals for any particular defect by screening, explaining to them the risk of their having affected children if they marry another heterozygote for the same gene. If heterozygotes' marriage can be prevented or reduced, the prospects of giving birth to affected children is diminished. Example: sickle cell anemia, thalassemia. 2. Retrospective. Most genetic counseling at present is retrospective, that is, the heritage disorder has already occurred within the family. Example: mental retardation, inborn errors of metabolism, psychiatrist illness. The method which could be suggested under prospective genetic counseling are contraception, pregnancy termination, sterilization. Common genetic disorders: cystic fibrosis, Down syndrome, sickle cell anemia, celiac disease, thalassemia, Bloom syndrome, Becker muscular dystrophy. Prerequisites of genetic counseling: detailed family history, accurate diagnosis, understanding the medical aspect of the disorder like etiology, natural history, treatment, prognosis, burden, understanding the inheritance pattern or occurrence risk, understanding the psychosocial impact of the information, training or experience in counseling techniques, understanding the concepts of health/disease, healthcare in appropriate cultures. Aims of genetic counseling: 1. Promoting informed decisions by involving family members. 2. Clarifying the family's options available, treatment and prognosis. 3. Explaining alternative to reduce the risk of genetic disorders. 4. Decreasing the incidence of genetic disorders. 5. Reducing the impact of the disorders. Purposes: to comprehend the medical facts, including diagnosis, probable cause of disorder and the available management, to appreciate the way heredity contributes to the disorders and the risk of occurrence in specific relatives, to understand the option for dealing with the occurrence, to make the best possible adjustment in an affected family members, to choose the course of action which seems appropriate to them in view of their risk and family goals, act in accordance with that decision. Explaining alternative to reduce the risk of genetic disorders, reducing the impact of genetic disorders, reduce the family's anxiety, assisting families in choosing the options most appropriate for them, to comprehend the medical facts, including diagnostic, probable course of the disorder and available management, providing psychosocial support, discussing the options available for dealing with the disorders. Function of genetic counseling. Session 1. Provide information to Available solution 3. Help person to understand and cope with his condition 4. Testing the risk of recurrence. Indications of genetic counseling. Hereditary disease in a patient of family. Birth defects. Mental retardation. Advanced maternal age. Early onset of cancer in family. Miscarriages. Malformations. Tendency to develop on neurologic conditions. Known or suspected heredity condition in family. A fetus of child with birth defects including either single or multiple malformation. A child with mental retardation. Recurrent spontaneous abortions. Beneficiaries. People who have a birth defect or genetic condition. Patients who have had a child with birth defect or genetic condition. Patients who have a child with development delay. Mental retardation. Women who had 3 or more miscarriages or infertility. There is a family history of birth defects or mental retardation. People concerned they may have inherited a tendency cancer, or to develop a neurological condition. Testing during the pregnancy indicates that the baby may have a birth defect or genetic condition. Mother who is 35 years or older at the time of delivery. Couples who are blood relatives. Information conveyed in genetic counseling. Magnitude of risk of occurrence and recurrence. Impact of disease on patient and family. Modification of disease impact or risk. Anticipated future development. Components of genetic counseling process. Information gathering. Diagnosis. Risk assessment. Information giving. Psychological assessment and counseling. Help with decision making. Ongoing client support. Steps/phases of genetic counseling. 1. Assessment phase. This is primary beginning phase of counseling. Initial interview with counsel and family for preparation of counsel for genetic counseling. Collect family history and other relevant history. Physical examination. Considering potential diagnosis based on collection information. 3. Diagnosis phase. In some cases, the goal of a genetic evaluation is to make a diagnosis of a particular genetic condition or syndrome. In other cases the diagnosis already is known and the genetic counselor or geneticist probably will confirm the established diagnosis to proceed for the next phase of counseling. Confirmatory or supplementing testing includes chromosomal analysis, biochemical test, molecular DNA testing, X-rays, biopsy, developing testing, immunological test. 3. Analysis phase. Literature search and review of informations. Consultation with other experts. Compiling of information and determination of recurrence risk. 4. Communication phase. Communication of the results and risks to counselee and to the family if appropriate. Discussion of the natural history of disorder, treatment, anticipatory guidance. Discussion of options and review of questions. Clear all doubts of the patient. 5. Referral and support phase. Refer the individual to genetic specialist for further intervention. For example, prenatal diagnosis and treatment modalities for genetic disorders. Support of decision made by counsel. Psychological support should be provided throughout the process. Follow-up and evaluation. Genetic counselor provides genetic information. It is their counseling skills, including their ability to empathetically connect with their patients, that leads to demands of their skills. Good genetic counselor have many strengths. They made their client's best interest their foremost priority and are only genetic counseling ethics. Respect the right of individual. Non-directive approach. Keep privacy of individual and family. Maintain the communication between counselor and his client. Goals of genetic counseling. Understanding the options. Choosing the course of action. Adjusting the condition. Comprehending the medical facts. Understanding the mode of inheritance and the recurrence risks. Role of nurse/nurse as genetic counselor. Receive the client and family and make them comfortable in assessment room for genetic counseling. Obtain prenatal, family has other family histories from individual and family. Conduct a primary physical information and collect other relevant information. Identify family surface. Investigate the problems present in the family. Provide psychological support throughout the counseling. Provide information about heredity pattern. Provide all explanation about all the question. Obtain an informed written consent for any planned genetic test or intervention. Encourages the individual and family to ask question as much as they can understand what about all aspects of disorder, Testing and management maintain privacy and confidentiality of all information related to individual and family. Only disclose information as per individual wish or permission. Ensure follow-up and supportive services to individual and family during entire course of need. Important role in follow-up, clarifying information, providing continuous support to the grieving process as appropriate helps to decrease the risk of transmitting the disorder. Discuss along with genetic counselor and family members on alternative arrangement as adoption, artificial insemination, surrogate pregnancy, prenatal diagnosis with selective abortion, prenatal treatment, curative treatment, genotherapy and fetal surgery.